Welcome, everyone. We're going to get started in 2 minutes. Thanks for joining us today. Welcome, everyone. This is Joyce Sacco with the Housing Alliance of Pennsylvania. We are so appreciative of you joining today's webinar on the Department of Human Services 5-Year Housing Strategy. Before we get started, I want to provide you with logistical information. Please make sure you get online while we talk so you can access the visual component of this presentation. You should have received an email from me yesterday and again this morning with instructions. First, click the Ready Talk link, enter your name, email address, and click Register, and you will be given access to the meeting. If you have any questions throughout the presentation, please type them in using the chat feature in the lower left-hand screen. We will also open up the line for discussion at the end of the webinar and to make sure all questions that were asked are addressed. Finally, the PowerPoint presentation and any additional information will be sent out after the webinar today. It's my pleasure to introduce today Ben Laudermilch. Ben was recently appointed to the position of Executive Housing Director at the Department of Human Services. Ben will oversee the implementation of the department's 5-year housing strategy. Prior to his appointment, Ben served as the Executive Director of the Cumberland County Housing and Redevelopment Authorities and has over 20 years of experience with community-based organizations. Much of Ben's work is centered on local regional planning initiatives and the development of a robust housing plan, as well as the development of low-income housing tax credit projects and other community and economic development initiatives. He has also worked on several housing initiatives across the country to develop housing and other opportunities for greater consumer self-sufficiency and economic growth. Prior to his recent appointment, Ben served for many years on the Housing Alliance Board. My experience of Ben is he's a committed advocate for those most in need, and we are excited to have him in this new position. Additionally, today we're being joined by Jonathan McVey with the Department of Human Services. He serves as the department's Executive Housing Coordinator. In this role, Jonathan has worked closely with staff within DHS and other agencies to develop the first ever DHS 5-year housing strategy. He serves as a project lead on the statewide implementation of Section 811 and shepherded through the first TANF rapid rehousing demonstration project in Philadelphia. And we hope as advocates to move that project throughout the state. We appreciate both of them being on the call today and updating us and informing us of the plans at DHS. So welcome, Ben.
Oh, thank you very much. Good afternoon, everybody, and I really appreciate this opportunity to speak to you. John and I were going to say a couple of words about ourselves, but I think Joyce, you did a great job in articulating what the two of us have done over the years. I did want to give a little shout out here. I know many of you from my prior work in Cumberland County and across the state on homeless issues. I noticed the self-determination housing project Pennsylvania Assistive Technology, Departments of Community and Economic Development, Aging, Health, PHFA, other state agencies. I noticed USDA is on the call, counties including my own home county of Cumberland, local government, developers, consultants, service providers, and friends are on the call today. And we really appreciate your support as we move forward with this plan. And thank you for joining us today. Secretary Dallas, the Secretary of the Department of Human Services, has made housing a high priority for the department. About a year and a half ago, he created the Office of Social Programs to coordinate and lead housing initiatives. He charged our office with developing a 5-year housing strategy, and some of you are probably familiar with the strategy. It's been out for about 2.5 months at this, or not even, about just under 2 months. The Office of Social Programs and the Housing Consultants conducted over 20 environmental scans with stakeholders and partners. So this housing strategy wasn't created in a vacuum. PATF, the Housing Alliance, DCED, PHFA, the Department of Corrections, the Department of Military and Veterans Affairs, HUD, and other members of the community and stakeholders were involved in the environmental scan. The housing strategy, as I mentioned before, was released at the end of May, less than 2 months ago. We did have a video for you. We had some technical difficulties. That'll be sent out. It's on our website as well. And it gives you a good idea of why we think having a statewide housing strategy is a good idea. I'm going to attempt, though probably not as well, to give you a little bit of some background here. So at the core of the housing strategy is the concept that too many Pennsylvanians in institutions could be living in the community with assistance. By our count, 53,574 people live in government-assisted nursing homes, state hospitals, and state centers. The national average cost is $62,750. Some of our numbers here in Pennsylvania dwarf that number, so we anticipate that that's a conservative number. The community-based living would be somewhere in half that, $31,340 per person per year. So transitioning just 500 individuals from nursing homes to independent living could save $15.7 million per year. And I think that case alone tells a story, let alone it's the right thing to do. Folks want to live in the community. An issue near and dear to my heart is the issue of homelessness. It is what I've worked on over the last 20 years at some of the key programs in Cumberland County. We're not very clear on this, but Pennsylvania seems to be experiencing an increase in homelessness according to our homeless point in time surveys back in 2015. We do anticipate that some of that is related to better approaches to counting, but we also have experienced in Pennsylvania that sometimes we're a little bit behind in economic recovery. I'm not even entirely sure we're experiencing an economic recovery right now, so it's an interesting time to be working in this field. So in Pennsylvania, while nationally we experienced a 9.35% decline in numbers, we actually experienced a bump, and we have over the last 3 to 4 years. A little bit more heartbreaking in this discussion and why it's so important to coordinate is homelessness and education. The average test score of children with homes is 71%, whereas average test scores for children without homes is 45%. And I think many of you on the call recognize, I think if some of you work in homeless programs, that we've not done a good job on the housing side in talking to our friends at the Department of Education, even though some of our programs have the same name, McKinney-Vento. So obviously there's some low-hanging fruit here where we could begin to coordinate a little bit more, make sure definitions of homelessness correspond, that sort of thing. The other thing that we think about here is that too many Pennsylvanians who have extremely low incomes are rent burdened. This is something that I think the Housing Alliance has done a good job of shedding some light on. So households at extremely low incomes make less than $21,106 per year. The maximum rent they can afford is $528. However, if you flip on the other side of this infographic, a one-bedroom average fair market rent in Pennsylvania is $739 per month, with an hourly minimum wage of $7.25. You would actually need to earn $14.21 for that unit to work. Average across the state, 46.6% of Pennsylvanians are rent burdened, which means they're paying more than 30% of their income towards rent. And that problem is more pronounced in the urban areas. It's more pronounced here in central Pennsylvania where we're located. So it does fluctuate across the state. But in general, it seems to be a growing problem, not a shrinking problem. Outlook is not much better for average wage earners in Pennsylvania who make between $12 and $13 an hour. So some studies suggest that average wages across the state need to be somewhere in the $18 to $23.27 in Philadelphia in order to afford housing. So in some ways, very and extremely low-income families are competing against folks who are beginning to approach middle income, 80, 70, 60% of area median income. There's another way to look at this too. Housing costs continue to increase across the state despite recent volatility in the shale regions. So this problem isn't going away, it's actually growing. And some of the Pennsylvania Housing Alliance literature seems to bear that out. We anticipate that we're somewhere in the neighborhood of 270,000 units short in affordable housing in the state of Pennsylvania. The housing strategy talks about efficiencies and collaboration along with the need to expand housing for all populations. I think it's important to point out that the strategy can only go so far without meaningful increases in investment in housing. And so that's something that we definitely need to take a look at. Before I kick it over to John, one thing that the video points out is the solution that we believe will work is government that works. We need to remove the barriers unique to each individual, and I would argue also between the silos of systems here at the state and at the local level. I thought this was happening, but I can see clearly that it isn't, that we're not necessarily connecting people with the housing opportunities that are available to them. And so that's low-hanging fruit as well if we have housing available for individuals. But I truly believe we need to expand, and I believe the Secretary believes that we need to expand affordable housing across Pennsylvania. Joyce and I had the opportunity to talk a little bit before this session started, and she informed us that the Housing Opportunities Through Modernization, HOTMA Act, passed the Senate and also had passed the House, and so that should be written into law. That could create efficiencies. I'm not seeing in my limited exposure to the Act an increase in dollars. So hopefully the efficiencies will help, but we need to understand that an investment in housing is going to be needed, is going to need to happen if we're to successfully house all Pennsylvanians. To do this, we need to take a look at partnering with local agencies. So this isn't going to happen at the state level exclusively. We can set the table, we can clear the deck, we can try to remove barriers, but 3 employees at the Department of Human Services are not going to be able to address all the needs across the state or even coordinate. So we're going to need to work closely with you guys to make this happen. We need to pool resources and share ideas. We've already started down this path. What are the innovative ways we can use funding? We had a moment at our press release a month and a half ago where we realized that there are 3, and actually our most recent count, 4 home modification programs at the state, and we're not entirely sure that they coordinate with each other. And so there again is an opportunity for greater coordination, collaboration. Finally, we need to utilize data to measure our progress. So as much as we want to get this work done, we have to make sure that what we're doing is measured and that the outcomes are there. So that's something we'll be taking a look at. To talk specifically about the goals at this point, I'll pass it over to John. And I think we're reserving questions until the end, Joyce?
Sorry, I was on mute. Yes, we're going to save questions to the end.
Okay. All right, and I'll kick it over to John McVey.
Great, thank you, Ben. And so what you just heard Ben lay out is kind of the need, the business case for why we're creating this housing strategy and the goals and strategies that we've outlined within it. So at a very high level, at the very end of what Ben was just describing is the high-level strategies. Then each strategy is broken down into a series of goals. And under each goal, when you get to the housing strategy, when you go visit our website after this presentation and pull the strategy up, you'll see under each goal there's kind of a basic timeline sketched out of 2015, 2016, 2017 to 2020. So that's kind of the general framework that we're working within. And I will speak to the first 2 strategies and some of the goals underlying each of those strategies. So I got to click through here. The first strategy is expand access and create new, affordable, integrated, and supportive housing opportunities. Currently, goal number 1 is implementing the Section 811 Project Rental Assistance Demonstration. It's a federal rental subsidy grant from HUD for people with disabilities who are age 18 to 61 and who have low incomes. The rental subsidy will pay up to fair market rent for an apartment with the tenant, only having to pay up to 30% of their income toward rent and utilities. PHFA is the primary grantee, and DHS serves as a core partner in this endeavor. DHS's role is to build the referral network to actually fill the 811 units and to provide guidance to the referral network on screening and managing their wait lists. The current status of this goal is that we have over 40 counties who are trained as a referral network, and PHFA has obtained commitments from property owners and developers for 87 units just in the past couple months. Now, as those units become vacant, the referral network will then refer applicants to those properties, and the person can tour the apartment and apply for a lease if they so choose. Goal number 2 is maximizing housing opportunities for extremely low-income populations. The Low-Income Housing Tax Credit Program is one of our first low-hanging fruit, easy targets that we're looking at really strengthening and beefing up. This goes back to, and I think we'll discuss it a little later on in the presentation, is strengthening and working with the local agencies, the local referral network. For this specific goal, we're targeting the 20% area median income units that are developed through the Low-Income Housing Tax Credit Program. And just as a side note, PHFA actually just released their Low-Income Housing Tax Credit Awards, I think yesterday. And maybe Ben can say a few words about that later on. Right now we're working with PHFA to map the process by which those 20% units are actually developed and constructed, so that when the units are beginning to come online, the local referral network will actually connect with that under construction development and make sure that people are ready to be referred as soon as the initial lease-up occurs. So as soon as construction's finished, people are already referred and can get connected to those 20% units. There are also a lot of units that are already built, 20% units that have already been built over the past decade or so. This mapping process will also help us to track those existing units and begin to really refer our populations to those units. Goal number 3 is provide tools to designated lead county-based agencies through IT enhancements. This again speaks to working with our local partners and making sure that they have the necessary equipment to act as a referral network. There are really 2 parts to this IT enhancement. One is under the 811 demonstration. There is a social serve module that is being built. Some of you may already be familiar with social serve and not realize it. PAHousingSearch.com was created by social serve through a contract with the Pennsylvania Housing Finance Agency. Property managers currently use PAHousingSearch.com to list vacancies. Our goal is to create an IT enhancement for 811 and for the 20% units that allows the referral network to log into an online portal, collect and build a wait list, and then refer individuals to those units, 20% units and 811 units. Goal number 4 is explore new and expanding funding opportunities to increase the supply of integrated and supportive housing. This really speaks to a multitude of different opportunities we have out there, but 2 really important ones that have come to light recently at the forefront are the National Housing Trust Fund and the State Housing Trust Fund. The National Housing Trust Funds are derived from a portion of Fannie Mae and Freddie Mac earnings, which are then distributed to state housing finance agencies, in our case PHFA, via a funding formula that is established by Congress. Pennsylvania is getting $3.8 million this year, And PHFA is expecting that, and Pennsylvania is expecting that to increase in the coming years. So PHFA is in the process of developing a policy that is in line with what the requirements of the National Housing Trust Fund are to distribute those funds. The other one is the State Housing Trust Fund, as I mentioned earlier, which is another excellent resource for Pennsylvania, and we should be really thankful to the Alliance, the Housing Alliance, and many of the folks, many of you who are on the phone on this call for your years of hard work for developing that legislation and pushing that through. And we're hearing anecdotally that this year's allocation is larger than the National Housing Trust Fund for this year. So these are just some examples of exploring new and expanded funding and making sure that DHS is at the front of the list and making sure that we're really connecting our populations to those funding opportunities or finding ways that can support our populations. That was strategy 1. Strategy 2 is strengthen and expand housing and housing-related services and supports. A lot of this revolves around a recent CMS bulletin, informational bulletin, which many of you have probably already heard a lot about. I know I've mentioned it on previous Happen calls. The goal here is to look at CMS, the bulletin, and look at housing-related services and identify ways that Medicaid can support tenancy and pre-tenancy services for DHS populations. So goal number 1, although not directly related to that, is very important, is the community health choices, which is expand access to housing-related services and supports through that. Some of you may or may not be familiar with this. CHC is the Office of Long-Term Living's move toward a managed care system. It is currently a fee-for-service system, so OLTL manages the Medicaid system directly through fee-for-service. CHC is moving away from that over the next 4 years to a managed care system. And the reason why this is important is it's an opportunity for us to develop contracts with the managed care organizations and incentives that increase access to housing-related services and supports. So the managed care organizations will work with their providers to ensure that housing-related services and supports are part of the provider's portfolio that they are giving to clients and consumers. Goal number 2 is increasing access to housing opportunities for individuals in the criminal justice system with serious mental illnesses or substance use disorders. Many of you are aware that this is a hot topic. It's in the media fairly frequently across the nation, and we wouldn't be doing justice if we didn't address this and reach out to the Department of Corrections, which Ben has already done. In fact, Ben was meeting with Secretary Wetzel of the Department of Corrections and attending correctional meetings and probation and parole meetings when he first started here. And he was actually attending a few more meetings with them than he was actually with us. So it's great that we already have that connection, and we're looking at some great pilots that are already out there that we can study. And we've been invited to continue to participate in their planning process around housing.
Hey, John, I also wanted to point out that right around the first couple of days that I was at the department, Secretary Castro of the U.S. Department of Housing and Urban Development released a memo that seemed to be signaling to housing authorities and those who receive HUD funding to take a look at this particular issue, that outright we shouldn't be denying people who are justice involved, have a criminal background. So there seems to be a lot of inertia here. Department of Corrections here at the state is very interested in how housing impacts their consumers, and I think at the national level this is getting a lot of play.
Absolutely. Thank you, Ben. Goal number 3 is maximize Medicaid funding for housing-related services and supports. So this is the goal that's much more directly related to the CMS bulletin I referenced earlier. That was released last June on housing-related services and supports. And I think, Joyce, if you can include a copy of that PDF or maybe a link to that PDF when you send out the information from this presentation, we'd appreciate it. So following the release of that bulletin, CMS released a notice of technical assistance availability using the Innovation Accelerator Program as the platform. Pennsylvania applied for and was awarded the technical assistance through that program. And Pennsylvania, the DHS program offices and myself participated in a series of webinars and technical assistance trainings over this winter and spring. They concluded at the end of April. And since then, we've been developing crosswalks, which are an informational tool for the program offices to use in looking at the waivers, the Medicaid waivers and the Medicaid state plans, and determining which housing-related services and supports are we either provide them or they aren't necessarily explicit in the plans and waivers as specific service definitions, or they're just not provided at all. There's gaps. So these crosswalks will help inform the discussion that we have and the analysis that we conduct to determine where we can improve, we can strengthen our housing-related services and supports, and ultimately receive Medicaid funding for. Ben, I think that sums up the first two strategies, if you'll take it from here.
Thanks, John. John had mentioned a little bit about the low-income housing tax credit strategy. I don't know if I'm clicking through on the right, but strategy number 3 talks about assessing new and existing programs to determine future needs and measure outcomes. One of the things that we've been talking about at the state level, and I'm sure is a concern across the state at the local level, is the fact that almost every program that can be used to generate housing is either been defunded or is oversubscribed to the point where there's not really any hope of growing the amount of affordable housing. The most recent low-income housing tax credit round is a prime example of that. The awards were announced yesterday, and 16 projects in urban areas, 23 projects in suburban and rural areas were awarded. They received 111 applications, so PHFA was only able to award a third of the need that's out there. And that is not anticipated to change anytime in the near future. So there appear to be very few ways to generate new housing, which again, I think that this plan illustrates how we could orchestrate a policy change and make things easier, streamline things, make things more efficient, and possibly generate housing if there's savings on the institutional side. But on the flip side, there is not significant investment, and that's where it's so crucial for all of you to be educated about things like the Statewide Affordable Housing Trust Fund and future initiatives, and arguing. I think there's been a general awakening and understanding that housing is many things and stabilizes people in many ways, but it is a social determinant of health. And I think that's the one. If you take anything away today, that is what you need to take away. There's an awakening. John, I don't mean to call you out on this, but the alphabet soup, I spent 20 years learning the HUD side of the table, and now I'm learning the CMS, which is Centers for Medicare and Medicaid Services, for those of you who don't know what that is. On our housing strategy, there's an acronym table, definitions in the back. So you can take a look at that, but I do encourage you to look that over when Joyce sends out the link. So our third strategy is to assess new and existing programs to determine future needs and measure outcomes. This is a very important strategy, and it's probably one of the hardest ones to implement. We need to assess and improve existing DHS housing-related programs. I think the prevailing thought is that housing's over at DCD or PHFA, and we're primarily human services over here, but we do have existing housing strategies. This strategy is of particular importance to Secretary Dallas, and I would think you'd all agree we must set these milestones, these benchmarks and goals so that we can measure our progress. Under goal number 1, assess and improve existing DHS housing-related programs, we're looking at a couple of things. We're in the process of assessing and improving programs like the home modification broker, multiple programs to coordinate throughout the state. I think I mentioned in the beginning of the call, DCD, PHFA, DHS, and OVR all have these programs, and they're not necessarily well coordinated. The other one is the tenant-based rental assistance program in the department, and that's a joint venture with the Department of Community and Economic Development. And that's done through the Nursing Home Transition Program in the Office of Long-Term Living. And another one that we hope to strengthen is the Homeless Assistance Program. That's a program I was a little bit more familiar with in Cumberland County and has done a lot of great work, and hopefully we can increase the effectiveness and hopefully the funding for that program. I'm sorry, I'm not very good at clicking through the slides. Goals 2 and 3 are on this slide, and strategy number 4, to promote teamwork and communication in both state and local government to develop housing opportunities for all populations served by DHS. I think this is the one that I skipped too far ahead. I apologize. Complete housing gap analysis, which is actually one of the most important things I think we need to do. A reflection of DHS's commitment to measuring progress, we're working with our consultants at the Technical Assistance Collaborative to determine not just geographic need, but also the substance of what it is that we need. But this can't be done in isolation. One thing that I've been thinking about, I think John and I have been talking about, is we performed environmental scans last fall, and spoke to a number of you on the call today during the process. And we continue to need to hear from our partners at the state and local levels, and we have some ideas about what that might look like. The reason I skipped ahead is I will discuss that here in a moment. My apologies. Goal number 3 is to establish and continually assess desired outcomes of the DHS housing strategy. John has discussed a number of concrete initiatives that are already underway. We have some low-hanging fruit, things that we think we can improve and that can be measured here at the department and between state agencies. So we've already started that work. Once we understand the gaps that we have yet to be identified, we can begin to set aggressive goals and regularly assess how far we've come within the context of the strategy. So we do believe that it's important not only to make these improvements, but to measure them. Some areas we're thinking about not only include the 811 program that John discussed and improving placements in the tax credit 20% units, which he also discussed earlier, but also the production of new affordable, integrated, and supportive housing opportunities for our common constituents. We talked about moving folks from institutional settings to community-based housing. And again, that's not only a way to save money or generate money, it's the right thing to do. We believe there's an opportunity to reduce homelessness through greater coordination between the Department of Human Services, the Department of Community and Economic Development, PHFA, and HUD, and the Department of Corrections. There are some real opportunities to collaborate on housing issues for justice-involved consumers, as I described earlier. And again, it appears that we have the support of HUD at this point in time to really take a hard look at this. Strategy number 3, and again I do apologize for jumping ahead, can't be done without teamwork and collaboration and input from all stakeholders, and that's where strategy 4 really comes into play. We need to promote teamwork and communication in both state and local government to develop housing opportunities for all populations served by DHS. This is so incredibly important because, as I said before, we can come up with all the plans that we want. We can recommend things, but really it's the work that you're doing here on the ground that makes the greatest difference. And we know that there are best practices out there that we could replicate and use across the state, both within and outside of the state of Pennsylvania. So we're taking a look at that and what we can do. Goal 1 is to strengthen our designated lead county-based agencies, also sometimes referred to as local lead agencies. Again, this is probably one of the most important strategies because it's at the local level that things happen. Some of you may recall participating in the environmental scans last fall. We're looking at different ways to consistently and effectively collect feedback about the strategy and housing in general. I think in the past the Housing Alliance has done a good job in with local jurisdictions in sponsoring regional housing forums. These could be the ideal conduit for this kind of information. I know that it was helpful in Cumberland County. As John mentioned, the hope is that strengthening and expanding the role of the Regional Housing Coordinator Program is a strategy for better coordination, but also for that feedback back and forth, state, federal, local levels. We're also looking at different evidence-based practices in Pennsylvania and other jurisdictions to see if those approaches make any sense. So we know that other states have had some success that we haven't had. I would think that they're looking at what we're doing as well. In fact, I know they are. I've gotten some calls. So again, the strategy number 4 is incredibly important. Strengthening the local lead agencies, aligning policies, and coordinating regularly with state and county agencies. This one is one that always had me scratching my head at the local level. I think I've told a number of you this story where one day I got an email about links, no wrong door, and coordinated assessment from 3 different state agencies. So we're not using, and those are all essentially the same thing. So we're not using the common language, and we're, different systems talk in different ways about these things. As part of our efforts to develop the local referral network and identify new funding opportunities and expanding access and availability of housing, we have to work with our partners. Our policies have to align and mesh with the state and county agencies to ensure our programs are operating effectively and efficiently. Goal number 3 is to develop public and private partnerships. This one's another interesting awakening moment. We're looking to work more closely with and develop new public and private partnerships with nonprofits and foundations of all shapes and sizes. There are resources and evidence-based practices out there that we need to leverage and replicate. Again, this is an exciting area because there seems to be a greater understanding that housing, as I mentioned before, is a social determinant of health. So we've already talked to some hospital affiliated foundations. I know that in fact our own Partnership for Better Health in the Carlisle area has begun looking at this when in years past I couldn't get my calls returned. So I think there's a real understanding that housing is a cost-effective way to impact health. Goal number 4 is to provide ongoing communication to stakeholders and advocates on the progress of the DHS housing strategy. This is, I don't know if folks really like doing this sort of thing. This is not the most fun part of implementing a housing plan, but we need to report back. It's very important to us that the communication and feedback with you all continues with consumers, stakeholders, partners, and advocates. In that effort, we're building a public website dedicated to the DHS Housing Initiative. Right now, if you go to that website, it's got the video and the housing plan in a couple of words, but we're hoping to grow that. It should contain information on how to access housing, regardless of whether or not it's a DHS program. This housing strategy is not intended to be set in stone. So our goal is to, as we report out, to have a feedback loop where we're evolving the plan and using what we've learned and what we're reporting out on, the information that we gain from you, things that have worked, things that haven't worked, every year so that we're able to roll that back into the housing strategy and change our work plan philosophy. Every year we're committed to providing status reports and updates on the goals we've met along the way and the updates that we have on the strategy. So we certainly look forward to working with you now and in the future. John and I are doing the tour of the state right now. A couple months ago we were out in Allegheny County. We've been up in the northern tier visiting a lot of our stakeholders and colleagues up there, and next week we're heading to Philadelphia. Actually, over a couple of weeks we'll be in Philadelphia to meet with a lot of the stakeholders there. Just to give you an idea of what we're doing right now. So we're doing our roadshow. This is one of our stops. We really appreciate you having us on the call today so that we could show this plan to you. Again, it reads like it's a lot of Department of Human Services, but our goal is to partner with the state agencies that really understand housing, Pennsylvania Housing Finance Agency and DCD, and to partner with other agencies across the state who touch on housing issues, labor and industry, and aging and health. So the goal is to bring as many partners together as possible. And I have John's and Ben's contact information here for you. At this point in time, unless John, you had anything else, I think we can entertain some questions.
Great, thank you, Ben. If someone has a question, please hit *7. That will unmute your phone. You can ask a question. Although we do have one from Jordan. Why was there no mention of increasing access to legal counsel for tenants?
I think that's an important, one thing I would point out broadly is that the strategy is not an attempt to cover every possible contingency. For one example would be transportation and access to legal counsel. These are both important parts, so being close to your job, close enough that you can walk, or accessing transportation, that's another consideration. So there are going to be things that we can't possibly mention in a 20-page document, but that's a very important consideration for our work plan, and I'm certainly making a note of it. John, did you have anything to add?
No, I don't have anything to add to that question.
Thanks, Ben. Again, if people have questions or comments, it's very impressive. Please hit *7.
This is Roy Diamond. I have a comment and a question. First of all, thank you so much for this webinar. You've given us a lot of information. It's going to take a while to digest it all.
Yeah, I agree, Roy.
The first question I have is, the first presentation touched on increasing sources of funds for housing supports inside the waivers. Right now, only the consolidated waiver is well known as a source of funds for housing, though I have heard of the over waiver being used for that, which is not widely known. Doesn't it really depend upon the legislature to really expand the use of waivers as a housing opportunity, because the legislature has to match the money from CMS? And, what are your thoughts and what is part of the strategy legislatively? That's one point. The second point is, Nancy Thaler, who's the Deputy Secretary of DHS, has been going around the state telling people that in the new world, they have to take care of their family, disabled adult children at home, that the money is not there, that she's decreasing, that the reality is that there's less money to providers to purchase group homes. And I wonder whether you've worked through with her, whether 10% of the units in a tax credit deal, or 15%, and then with the 811s we can go up to 25%, are for people with disabilities, and they each have individual units with kitchens and baths. Will the department interpret that as consistent with or inconsistent with Olmstead? We are finishing construction on a 42-unit building in Allegheny County that has a preference for half of the units for adults with autism. And we believe that we are outside of the department's concerns, so that waiver holders can actually lease those apartments individually. But we're not sure. And we just want to make sure that the department is not getting in its own way in your efforts to carry out some of these very interesting housing strategies.
No, I think you have hit the nail on the head. We're right at the forefront in understanding. So the absorbing what the CMS memo seems to be suggesting, which our interpretation, and John, I'll kick this over to you. Your policy understanding is greater than mine, but our interpretation is that it's not for housing costs directly, but for the supports and services that support people in a tenancy. So in other words, there wouldn't be necessarily an opportunity directly through Medicaid to pay for housing services, but for the services and supports. We do have some innovative thinking internally about what that might look like, and it's our stance that the CMS memo, it needs to be tested, but that going towards some innovative strategies around housing, some of which has already been done in Pennsylvania, and CMS looked to historically in Pennsylvania in informing their decisions around the memo from last summer. So it's our stance that we won't need some sort of statutory or congressional action to change this, because we're focusing on services and supports.
That's great.
Yeah, also, go ahead.
sorry, Ben. It's Joyce, and that's my understanding as well. And we also have, I think Pat Keenan from FAN is on the webinar as well, but it's for services, not for the housing.
Gotcha. Pat, I'm sorry I didn't call you out earlier.
Just to conclude that conversation, one of the crises is that wages for support workers are in many cases lower than $15 an hour, which is the movement to create a minimum wage. And really, again, the quality of is, unfortunately, I'm a consumer, as I have a profoundly disabled adult son. And while there are services out there, the quality of services is an issue, particularly because the wage rates for the actual people that come into contact with consumers are very, very low, and in some cases less than $10 an hour. Again, I think that goes to the legislature, and I was wondering whether your initiatives could address that.
Implicit in the slide deck and in the housing strategy is a discussion that touches on but does not go head first into the discussion about wage issues and whether or not the minimum wage should be increased or some other approach should be taken. I think it's something that we're going to have to talk about because we have two things moving in the opposite direction. Wages are flat or in some cases even decreasing, as we see. I noticed in Carlisle, Cumberland County, Pennsylvania, that good manufacturing jobs have been replaced by warehouse jobs. So we see wages going the wrong direction. We see housing prices going up. And so the pressure is on. So I agree with you completely. I think it's something that we're going to have to weigh in on, and I'm not sure it's something that I can speak to from the department's perspective at the moment. I did want to step backwards. And by the way, my first week here, somebody mentioned the issue of wage rates for the people who serve the folks that we're concerned about. And so that's not lost on any of us, that we have a real issue where we have an expectation that these service providers provide high quality care, and the turnover rate, as soon as somebody who's getting paid less than $10 an hour can find something better, they're off to the races. There's an expense associated with training a new person. I think we're short-sighted in some of that thinking. That's a provider issue. It's something that we want to be thoughtful about because there are many different opinions. I'm sure you're aware of that, Roy. But Nancy, you had mentioned Nancy Thaler and the Office of Developmental Programs, and I just wanted to make sure we just met with her this morning, and we're talking about strategies to increase housing, group homes for people who can't necessarily live independently at this time or maybe never will be able to. So we need the intermediate steps in the community that provide housing opportunities. But I agree with her. I think the problem is there really is no money. We're living in austere times. The state budget is not any brighter than last year's state budget. There's some bright spots, the increase in fare, but these are not initiatives that are necessarily coming out of state government. The Fed, modest increases. National Housing Trust Fund's interesting. I think we're hoping that we begin to recognize as a nation the need to invest in housing. But Nancy's absolutely right. We're just hoping that we can find some approach to addressing those issues. But the wage thing is huge, Roy. And I don't have any good answers. John, I took all of your time.
And let's see if we can also open it up for other.
Sure.
Thank you, Roy.
Sure.
Appreciate that. Other folks on the call have questions or comments for Ben? Again, it's *7. Ben and John.
Hello, this is Jeff from PA Silk. Can you hear me?
Hey, Jeff.
Hey, I was curious as to whether you've engaged members of the state legislature. I'm thinking in particular of at least two or three subcommittees, one like Senate Urban Affairs and Housing and the House Urban Affairs. You also have the folks that are in Public Health and Welfare on the Senate side, and then on the House you have Health, and you also have Human Services. And with Community Health Choices being linked with what you're doing, and also the home mods broker, I was just curious if there's been any engagement, maybe something like a joint meeting to discuss the governor's housing plan and solicit feedback from legislators, since they're making the budget and many of the policy decisions that we all have to live by. I was thinking it might be good to engage them a little bit. I was curious, or maybe that's already going on. I'm not aware of it.
Jeff, it has not happened to a large extent during my time here. I've had one legislative meeting that was canceled, Senator Hughes. John, I don't know if that kind of work informed some of the housing strategy before May over the last year and a half.
It did. Actually, one of the legislators we reached out to during the environmental scans was Senator Hughes. He has a particular interest in homelessness, being from Philadelphia. And he was actually one of the individuals that helped us push out the TANF rapid rehousing program that Joyce mentioned at the beginning during my bio. So Senator Hughes has been involved a little bit, but that is certainly something that Ben and I can work on and reaching out to the state legislature and working through our Office of Legislative Affairs.
And of course, we were a stakeholder in the discussions around HR 550 and some of the legislative planning around homelessness, and we support many of the initiatives that are called for. So there is some linkages, but Jeff, you make a really good point. Thank you.
Sure.
Other questions? Again, it's *7.
This is Lynn Kirschenbaum from HUD. Hello, everybody. Thank you for the great presentation. Hello. Kind of following up from the discussion on homelessness, I was wondering earlier whether this is going to be a priority population for the 811s and the 20%, et cetera, et cetera. I know there's a lot of competing populations, but I want to keep that on the forefront here since there's federal goals to end homelessness for all populations by 2020.
Hey, John, could you talk a little bit about the 811 priority populations? I also wanted to follow up a question for Lynn.
Yes, absolutely. So the 811 priority populations, in Pennsylvania's application, we outlined 3 priorities. The first priority being individuals who are institutionalized but could live in the community with supports. And priority 2 are people who are at risk of institutionalization. And that group contains the homelessness population. And we broadly defined it, so that would include individuals who are couch surfing or doubled up, so as to be as inclusive as possible and include people who are at risk of institutionalization. Priority 3 includes people who are in congregate care, so long-term care facility, residential treatment facilities for adults, CRRs, community residential rehabilitation facilities, general congregate care settings. So those are the 3 priority groups, and those populations, those categories are intended to help the referral network manage their wait lists. So for at least 811, the homelessness population is a priority 2 grouping.
Okay. That's great. And what about the 20% units with the tax credits for the lower income?
Well, the great thing about the 20% units is that they're more broadly, they're more open in scope. In other words, the door is wide open for anyone with an income at or below 20% area median income. So in terms of outreach, it's incumbent on us in building the referral network to ensure that the referral network is connected to the homelessness providers in their area. And in a lot of cases, or in several cases rather, the referral network is actually a homelessness provider. So in Dauphin County, the Capital Area Coalition on Homelessness, George Payne, is our local lead agency, is part of that referral network. Philadelphia, the Office of Supportive Housing, under the guidance of Liz Hirsch and Bill McIntyre, is a homelessness-oriented agency, and they are the local lead agency.
But what I was going to mention is that we're going to need to take special consideration of homelessness because so often developers and managers have the opportunity to select people at or below 20% of the area median income who maybe don't have some of the challenges of a chronically homeless individual or credit score, criminal background. All of these things come into play with our justice involved. one of the things that I've been a little concerned about, and I've been hearing very loudly in my new role, is that the disconnect between the changes that the HEARTH Act brought to homeless programs and the people who are most likely to be served, who are chronically homeless, justice involved, may be institutionalized for over 90 days, which in a lot of cases that is the case, or imprisoned for that period of time. So we have more discussions that we need to have between the state and federal level about some of the incongruencies we're seeing across the board there, and I'm sure that there are people more educated on the line who could talk to that. But Lynn, I wanted to ask you, is there some push now that Secretary Castro is talking about this justice involved? I know in my early days of being trained, homeless programs were never for people coming out of the criminal justice system, and yet a lot of times those are the individuals we're dealing with in the homeless system.
Yes. People who were just as involved, that's a huge overlap with people who are homeless. So there is a push to house them as well as part of that system. There's a lot of discussion on that, and there's even a grant program going on. So there could be a whole topic on that.
Right. Yeah, we could have another webinar on that alone.
Yeah.
Thanks, Lynn.
Thank you. We have time for one more question or comment for Ben and John.
This is Roy. Am I permitted if no one else is asking a question?
You are permitted, sir.
Thank you. So we know that the 811 program restricts the percentage of persons in a affordable community to 25% if you use the 811s. We know that the agency's guidelines make available 10% of the units for people at 20% or less. Do those maximum percentages reflect DHS's policy or approach to how many people or what percentage of people with disabilities should be housed in the same community?
Well, if I could speak to that, I think you have two things going on. One is HUD's thought process around the 811 program. I've heard it stated that 10% reflects, of persons with disability, reflects approximately the population in the United States. About 10% of folks have disabilities. So I've heard that argument. I think the short answer is that if you look at our strategies, we need to align policies and coordinate regularly with state and county agencies. We need to get on the same page on what that looks like. I'm not sure if entirely that's what you were pointing out as the inconsistency between the two. I think there's still a conversation going on currently in the department about what our expectations should be there. We certainly want integrated housing. We don't want to see we don't want to encourage housing that's single purpose, where we're creating large concentrations of a single population. On the other hand, we want to be reasonable about serving the population and understand that if we restrict it to 10%, for instance, we're going to serve fewer of the traditional consumers of DHS services in housing.
I guess the reason that the issue has been particularly evident for us is that some of the larger regional nonprofit providers who previously amassed large numbers of group homes, are seeking to change in accordance with the changes that we've discussed. And they've been interested in developing multifamily affordable housing. But if you say to them that only 10% or 25% of the units created can serve the populations that they serve, then it becomes a little more problematic for them.
Understood. Yeah, it's definitely something we have to take a look at and make sure that, because there's a domino effect, a well-intentioned policy could lead to unintended consequences.
Exactly.
So it's something that we're in the process of looking at for sure.
Cool. Thank you so much.
Thanks.
Any other questions? Well, on behalf of the Housing Alliance and our members and board, I just wanted to thank Ben and Jonathan for their work on this, for joining us today. We, as always, are open to helping implement or be part of making this a success, because it's all about getting resources to the people and communities. So, again, thank you. Everyone stay cool, and happy Friday. Thank you, Ben and John.
Same to you.
Thank you so much.
Ben and John, so much.
Thank you.
Bye-bye.
Take care.